Do I have GAD, Generalized Anxiety Disorder, or do I have OCD? That's a question I had from Brendan. He told me his therapist diagnosed him with GAD, Generalized Anxiety Disorder, but he thinks he has OCD. He thinks that might explain why the talk therapy wasn't very helpful for him. I thought it might be helpful to point out the differences between GAD, Generalized Anxiety Disorder, and OCD Obsessive Compulsive Disorder. Hi, I'm Paige Pradko. I'm a therapist that specializes in anxiety disorders and OCD. Welcome to Therapy for a Better Life. Today I'm going to compare what people experience that have GAD, Generalized Anxiety Disorder, compared to what people experience that have OCD. Because there's some similarities and there's some differences. And it's important to know the difference because it will affect your treatment choices. Now, before I get right into the meat of the video, I left you a gift in the description. It's a PDF called What Do I Feel in My Body? Explanations of bodily symptoms due to anxiety, stress, and panic. And there's a free assessment there as well for OCD if you're interested. Now, first, people with generalized anxiety disorder typically experience excessive worry and anxiety about different topics, events, activities going on in their life. So not only is there constant anxiety and worry that's really out of proportion to the topic, but there's also physical symptoms too, like feeling tense and this inability to relax, a restfulness or nervousness, sometimes even trembling. Now, they can have symptoms like sweating and IBS, irritable bowel syndrome, nausea, muscle tension, irritability, trouble sleeping. People with GAD have difficulty setting aside these worries. They have sometimes trouble concentrating. Now, they really do kind of overestimate this danger or threat, and they underestimate their ability to cope. They're overthinkers. They're also often like these excessive planners. They're trying to cover all their bases. They can be perfectionists, and they tend to over-prepare and overdo, kind of striving for perfection and approval. Yet they sometimes lack confidence even though they do all this over-preparation. So many of their behaviors are this attempt to kind of control uncertainty. And they do have this overall kind of difficulty with uncertainty. So what other conditions do you know that have difficulty with uncertainty and are overthinkers? Did you guess OCD? There's lots of similarities, as I said, between GAD and OCD. Now, people with OCD also have worries and anxiety and rumination and catastrophize, and they, kind of run through these what-if scenarios. And they are also overthinkers, and they have difficulty tolerating doubt and uncertainty. So there's this overlap between people with GAD and people with OCD. But I do want to point out some key differences so that you know the difference when you're looking into treatment. Now, first, people with OCD have what we call sticky thoughts. Now, the thoughts and the images or sensations can really become stuck, and they can become obsessive. So people with GAD, they have worries that kind of jump around from topic to topic. Now, the worries might be obsessive, but they're not the same worry repetitively. I've heard it described that, GAD feels more frantic, where OCD feels like they're kind of spiraling in loops. Number two, that brings us to the content of thoughts. So people with OCD experience obsessive thoughts that are the opposite of their character. They're the opposite of who they know themselves to be. They're the opposite of what they care about and what they value. And we call that ego dystonic. They have thoughts about things that they absolutely do not want to be thinking about. And the thoughts tend to be more irrational, more magical, but they can be very specific. If I have this thought, then I have to hold my breath, I have to tap 3 times, or something bad is going to happen. Now, OCD is not logical, but it has a way of attacking people right at their deepest, darkest fears, and it really makes them doubt themselves. People with GAD typically have worries surrounding what they're doing or what they're going to do. Their worries are real life concerns, what's going on right now in their life. They're blown out of proportion a bit, but they're more about what's going on right now. What if I don't get that job? What if I don't pass that test? Now, number 3 brings us to talking about rituals and compulsions. People with OCD may do physical compulsions. The rituals might be washing, blinking, checking door handles, tapping, doing something over again to get a just right feeling. And they can also have mental compulsions, ruminating, analyzing, replaying things, repeating things, counting, neutralizing bad thoughts with good thoughts. The purpose of these compulsions and rituals the purpose is to self-soothe, to calm their discomfort, but they actually feed the OCD cycle. For people with GAD, they typically do not perform these kind of rituals and compulsions like people with OCD, but they can have some of those behaviors. And they often do avoidance behaviors, and they can ruminate and have some of these mental compulsions going on that also maintain their anxiety cycle. So it's important to know whether you experience GAD or OCD, because ultimately it affects your treatment. Now, a trained therapist is going to interview you and review your symptoms and your history, and they're going to include some assessments, possibly the Yale-Brown Obsessive Compulsive Scale and the DOS and other measures before giving you a diagnosis. And to make things a little bit more complicated, it is possible to have both conditions going on. So as far as treatment goes, the gold standard treatment for OCD is ERP, exposure and response prevention. It's the first line of treatment. And there are other therapies like ACT and mindfulness, medications that can be added to that treatment as well. Now for GAD, for anxiety, ERP can sometimes be effective for GAD. But there's other therapies that are used too that are focused more on thoughts, like cognitive restructuring, that's part of CBT, cognitive diffusion and ACT therapy, and acceptance and mindfulness-based therapies. Now don't forget, I left you a gift in the description of the video. So until next time, I'll see you in session. Take care.